Okay. Welcome, everybody. We're going to have people still joining the call, I suspect, but that's okay. We'll just keep chatting. So the webinar is being recorded today. My name is Terry Lee Kelford. I'm the co-chair of the National Alliance. Welcome, everyone, on this getting closer to spring February day. We have a lovely panel of presenters today talking about this hot topic of migration. We were just talking before the webinar started about how there's been talk about migration for probably 20 years, as long as I've been doing this, and yet it's not a topic that's been well explored, I think, in terms of research and evidence base. But we're hoping to shed some light on it today from that perspective. So just to get us started, before we introduce our panelists, just want to take a moment and acknowledge the fact that I'm on the unceded, unsurrendered territory of the Algonquin people. I'm calling in from Lanark County today, and regardless of where we are across the country, we are on the ancestral unceded territory of the First Nation, Inuit, or Métis. So important to take a pause for that always. This is our basic agenda. So I'm not going to take long because I want to give lots of time to our panelists today, but we are going to have the panelists introduce themselves, talk about their position, their agency as we get started, and then we're going to open it up to sort of some pre-formulated questions. But I think you'll find that each of the panelists come from a bit of a different background, but can add to this conversation around migration, people moving back and forth between rural and urban centers. We'll give you different perspectives. So I'm going to invite everybody, as the presenters are talking, that to type in any questions you may have or comments into the chat box or the Q&A. We'll get them both, but chat box or Q&A box, write in your questions as the presenters are talking, and we'll cover it at the end. We're going to try to limit the chatting to 50 minutes, but I know some of these presenters and they like to talk, so like me. So see, I'll try to keep them on track so we have lots of time for questions at the end. So without further ado, I will stop sharing, open up the screen so you can see everyone, and get started. So I'm just going to go with my screen to see who's in front of me to lead introduction. So Holly, that means you're up. So do you want to introduce yourself and talk a little bit about your agency?
Sure. My name's Holly Ferris. I am the homelessness specialist with the city of Yellowknife in the Northwest Territories. We are the community entity for the Reaching Home federally funded program. We have the Community Advisory Board, also known as CAB. And through CAB, we have identified an opportunity to assist in preventing and/or eliminating homelessness within our community, and understand that there may be gaps in services or a lack of services regarding homelessness. Through collaborative sharing, innovative strategies, and effective problem solving, members from relevant sectors of the community gathered to develop, establish, and implement with collective wisdom a community-based approach to meet existing and emerging homelessness needs within Yellowknife. And as of January, we actually changed our terms of reference for CAB to fit the Reaching Home directives, and also took into consideration the 2018 point in time count findings. So with that, we updated our CAB membership to include 2 persons with lived experience, added an additional individual from an Indigenous organization, an individual from an organization serving women and families or families fleeing violence, a public at large, an RCMP member, a landlord association or non-government housing sector, non-government health organization, including organizations focused on mental health and addictions, Veterans Affairs Canada or a veteran serving organization, and a local business.
Great, thank you very much. That's great. You're also a member of the steering committee for the National Alliance to End Homelessness.
Yes, I am.
Don't forget that important plug for us today. Cassandra, over to you.
Hello, so my name is Cassie Gogo. So I'm a prevention diversion case manager here with Home Based Housing in Kingston, Ontario. I also chair the Kingston Hoarding Coalition. So here at Home Based, so we are funded by the city of Kingston as a Housing First program for a 10-year plan to end homelessness, hopefully here in Kingston. We do.
Did I interrupt you? Go ahead.
That's okay. Sorry, I'm easily distracted. Don't mind me. So yes, so we have the adult shelter here in from the Colt. And in our adult shelter, we actually track where people are coming from. So we know pretty consistently that here in Kingston, we see about 30% of our shelter population is coming from outside areas, including rural areas in the area. So,
Okay. Great. Thank you. All right, Mike.
Mike Lethby with the Raft. We're based in the Niagara region in the city of St. Catharines. Primarily, I think the Raft has a pretty similar history to a lot of youth serving organizations. We started off as a sort of a drop-in program in the 90s, made a transition over to providing shelter beds primarily in the early aughts. And then I think we've taken a bit of a turn, a deviation from the norm, and that we really got into prevention work, largely driven by some data that we found that was about migration within the Niagara region and how best we could alter our programs to actually service the needs we were actually seeing as opposed to what we assumed we were seeing. And so since about 2008, we've been running a program that really gets at the heart of immigration and what the needs are in the community. And since that time, we've seen about a 70% reduction in our shelter usage. And across the board, because we've been doing it for just over 10 years now, we're actually seeing that the ages beyond where that we actively work with. So, you know, the people who are 30 now that were 20 when we started, there's actually less 30-year-olds in the system because they didn't start off in the system at 20. So we're actually seeing some generational effect now, where we're getting trend lines coming down. So it's pretty exciting. I mean, I'm extremely proud of the work that we do, and I think this topic though was critical because it was really this question of immigration that changed everything about how we delivered our service. So I'm excited for this conversation.
Great. Thanks for joining us. Sheldon.
Hi, folks. I'm Sheldon Paulette. I'm the Executive Director of Choices View here in St. John's, Newfoundland. We run an agency, probably not dissimilar to many across the country in terms of a range of services and supports to youth and vulnerable families, including outreach services, shelter, emergency shelter, you know, an array of supportive housing programs. We have gotten into delivering social enterprise for young people as well to meet their training and employment needs. We do mental health. We do downtown health collaborative work as well in partnership with our health authorities. The breadth of the organization at this point represents, I would say, a 30-year evolution of understanding, you know, what the true causes and conditions of youth homelessness are in our city and certainly our province. And putting as much energy and effort as we can to create innovative solutions. That now includes, prevention work in the form of an upstream pilot project, getting into junior highs for the first time to begin addressing the educational, but other support needs of vulnerable youth in that setting, as an eye to increase school engagement. And as we've come to articulate for our school partners, everything you would do to increase school engagement are the exact same measures you would take to decrease future vulnerability for youth homelessness. So really evolving, challenging ourselves day in, day out, you know, working with the usual cast of characters, many of whom are on this screen and across the country, to continue to bring, I guess, a spirit of innovation and really strategic thinking to how do we get to the root causes that we see. I've posted a bunch of articles that I will walk through as part of my presentation in the chat box. Understanding the history of each of these reports going back to 2015 really tells a story of the evolution of our understanding as an organization of the real root causes across our entire province of youth homelessness, and I guess our path to trying to meet the needs of rural youth as part of that work.
Great. Thanks, Sheldon. So I mean, you've touched on a little bit as you've all been talking, and I can share from a personal perspective the reason why this is so important to me as well. This conversation is that 21 years ago, I helped establish a community coalition in Lanark County, rural Lanark County, between Ottawa and Kingston in Ontario, for the very reason that the only response we had 21 years ago to youth homelessness was to put kids on buses and send them to a shelter in Ottawa or Kingston. So we created a community coalition in our area to work together as agencies to say, we got to do something about this. We can't keep dropping young people off in the cities without any follow-up or supports, and hope they make it to a shelter without any guarantees. So so for 21 years now, we know that that this has been a factor, but I've been asked about it. I was talking to Mike about this, sharing just the lack of data and research around it, I think makes it a complicated conversation for some people. And so I think I'm hoping to shed a little or create a little concrete information and data like Sheldon shared, and you know, our experience will hope provide a little concrete evidence around this topic of migration, how important it is, I think. So the next question then is just to take time from each of you to talk a little bit about migration and how it affects your agencies. What does migration mean to you or look like for your agency? So anybody want to start? Mike?
Sure, yeah, I'll kick it off. So yeah, like I was saying off the top, understanding that migration was happening was a critical component to our sort of pivoting as a program, moving away from emergency shelter primarily to a primarily prevention focused. So just a little bit about the Niagara region. The Niagara region has about just under 500,000 people living in it. There's 12 municipalities, and one of them is St. Catharines. That's the main city. So we're sitting at about 140,000 people, but we're largely surrounded by smaller towns and amazing rural areas where, you know, it's a breadbasket. Like there's just tons of fruit here and everything's nice. But when the service was originally designed, it really, you know, our underlying assumption was that the shelter we were operating largely served the kids in St. Catharines. We weren't looking to deliver a regional service. It was really for downtown St. Catharines, and you know, we had a bunch of circumstances that caused us to have to sort of look at who we were serving back in, you know, 2006, 2007, and our assumption was completely off. At that time, we found that about 60% of the youth who were accessing our shelter, which was a 24-bed shelter, and we were seeing about, at that time, about 500 individual youth come through us, utilize a bed in a year. So 60% of those kids were actually coming from outside of St. Catharines. And so we started looking, again, we never thought to ask, right? We just made assumptions, and I found that speaks to that data. Like we just kind of had this story we were telling ourselves, and no one ever thought to check to see if it was real or not. And it turned out that pretty much every story we told ourselves ended up being wrong, which is kind of embarrassing, but anyways, that's the reality. So we started working with groups in the rural communities to basically try and stem that migration and see if there was a way. And that's how we got to a program, which I think we'll get some more details on a little later. But just to give the highlight though, so from 2006, 2007, when we had 60% of our clients coming from outside of St. Catharines, that's now down to 5%. So yeah, we've done a significant, and you hit it. I mean, people, it was the bus system, right? Or hitchhiking. I mean, these kids were just kind of finding their way into St. Catharines, which happened to be the largest urban center, which also then happened to have all the services, right? So I think the Niagara story is probably pretty common across Canada. I think we're pretty representative of what the Canadian experience is like, of small to mid-sized urban centers being the service hubs and surrounded by large rural communities, right? So anyways, that's kind of how immigration, what we've seen, and we can get into some of the other stuff I think later on vulnerabilities and programs.
That's great, Mike, thank you. And interestingly, I think right now as the country starts to talk about coordinated access, I think that's another piece that needs to be added to the conversation of coordinated access, is how do you coordinate services, not just within the city, but also with your urban surrounding communities, right? So, and so over to you, Holly.
So for ourselves, we are the capital city in the Northwest Territories. Our population's about 20,000. Our territory is 44,000. In 2018, we had 338 people that were homeless. We are the hub for services within the NWT. We have the large regional hospital. We have the adult male and youth correctional facility, as well as one of 5 territorial courts. Based on the 2018 point in time count, only 16% of those experiencing homelessness were actually from Yellowknife, which was a little shocking, to be honest. And of the migrants, 68% were from other communities within the NWT. Some of those were from Betchico, which is about a 45-minute drive away. Others were from Hay River and Fort Smith. And 32% of the migrants were from other territories or provinces. So of note would be Nunavut and actually Edmonton. So we found that to be really interesting. I mentioned before I joined the webinar that Hay River has since opened up a shelter. So it'll be really interesting to see what happens in our 2021 point in time count. We were supposed to have one in 2020. Due to COVID, that was postponed. So we're doing one in April. Yeah, it's an eye opener.
Yeah, that's amazing. And the federal pick counts, I believe, actually just started asking questions about, are you from here or have you moved here within the last 5 years? So I think there's actually been some interesting reports come out of that. Yeah.
For sure.
Sheldon, do you want to go next?
Sure. I think for us, I mean, I posted all these documents, certainly not going to go through them in detail, but really what it speaks to is we, in 2015, released a report calling on the provincial government to adopt, similar to Alberta, a provincial plan to end youth homelessness. That to this day hasn't happened, but it did catalyze and keep the conversation moving in terms of how to focus on, you know, what is happening amongst youth across our entire province. And part of this is coming to the realization that a lot of the young people who are ending up in shelter services and other services in St. John's are absolutely coming from other parts of the province. Part of that, for example, began then to show up in when we finally were able to implement a point in time count, and we were one of the communities and agencies asked to pilot a youth specific point in time count, which was incredibly effective. What clearly showed was that over 50% of the young people at any given time entering the shelter systems in St. John's were from other parts of the province over a 2 to 5 year time frame. So of course, then it, you know, how does that begin to inform, you know, your understanding of where the solutions lie? The other thing I will add, between 2006 and 2008, Joseph Youth, you know, was serving the needs of, I think, 454 young people as part of a national study over a 3-year period. And as of last year, we were serving, I think it was over 1,500 young people in 1 year. So when you look at, you know, the explosion in growth in the number of young people that are coming to us in need of supports and services, combined with the understanding that 50% are coming from other parts of the province at any given time. And you have to realize as well that we have a island part of our province and then a mainland part of our province. It becomes even more dramatic in terms of, you know, the challenges for young people, for example, in the mainland part of our province, accessing services on an island. It begins to tell a story around where our energy and focus needs to be. Through that, I think for us, it's driven our organization to, through the support of the federal government, begin looking at, you know, a provincial expansion, not because, you know, it's serving the needs of the organization, but through provincial expansion was our path towards, in a more prevention-based way, getting to young people long before they have to end up in St. John's. Through that work, we've now landed on a model out of BC called integrated service delivery. It's primarily a mental health service delivery model, but in doing so, you're going to touch on everything else. You're going to touch on family violence. You're going to touch on youth homelessness. You're going to touch on, leaving the educational system. So through that work, and every time we do it, we go back out, and now we're starting to talk to hundreds of young people and families across the province, and hearing exactly what we knew we'd hear. It's the desperate search of supports and services, or running away from something on the part of young people that there are better solutions for. So through that model, we are now working with the provincial government to look at setting up at least 4 integrated service delivery hub sites across the province, hopefully in the next 2 years. So I guess focusing on what it means for our organization and how that's driven an entirely new conversation about where we're trying to go to meet young people closer to their home communities, so that they don't have to have that migration. Because we were all well aware that, yes, in lots of ways, there's a lot more supports and services in the urban center for young people. But guess what happens? Those young people are also exposed to a higher degree of vulnerability and risk at the same time. And then, that cycle for young people is not taking them at all where we want them to be.
That's great. Thanks, Sheldon. You guys are doing some great work. Cassandra, do you want to talk about it? You're a frontline service provider, so.
I am, yes. So Kingston is right on the 401. So that connects us to Ottawa and Toronto and all of the tiny little communities in between, which there are many. And so we get tons of people coming from, especially these concentrated from these rural areas, because of lack of shelter and resources. So as a prevention worker, I see that in my role. Either people who are at risk of losing their housing or already have calling in, or social services providers calling, or family members who will say, hey, can you please house this person in Kingston, because Kingston has a housing program, Kingston has a hospital, Kingston has this, Kingston has that. And so I frequently have people calling and saying, hey, like, there's no resources where I am. And we try and keep people where they're at, because we know that when somebody is uprooted from their natural supports, they are, and Sheldon, you touched on this, the risk of exposure increases greatly. So we have people who come to Kingston from a small town who are then all of a sudden in a shelter and being exposed to the drug culture here, which is a huge concern. Yeah, so we do see migration quite frequently, and we see seasonal migration as well. So we do see the opposite, where people who are in Kingston travel to rural areas in the summer months to try and escape the negative effects of the drug culture.
Oh, interesting. Okay. And we've heard about that, actually. I've talked about, there was another member of our steering committee is from Prince Edward Island, for example, and we had a person with lived experience on our committee who was talking about how they were actually sent from a city to the rural community, thinking they could get more affordable housing and services, maybe even faster, right? Less people competing for the resources available. So I do think there's a migration back and forth. But so that kind of leads us into our next question, which is around the challenges and assets. Are there actual benefits to moving from a rural community to the urban center to access shelter services or emergency services? And what are the risks? And I think, Sheldon, maybe you want to start, because you actually already touched on this. There are vulnerabilities for sure. Mike, you talked about this too. The risks involved in, we work with youth, so obviously dropping a young person off in a city and watching them fend for themselves is tough to watch for sure. But it also affects adults, I think, too, and we've had that happen to adults as well. And Sheldon, if I may, you also had a report. I think you did a report very early on when you were exploring the idea of expanding to rural communities. I just remember this one line about connection to land in it, where it was really important to stay connected to nature and to land and to community.
So that's the We Are Ready report. So it's the second report that I've posted there. And that was really, not making assumptions. We're, I've learned a lot about youth homelessness. We've adapted a lot of models to St. John's, because St. John's is a very different city to, many others across the country. So not making the same mistake when we turn around and then say, well, we're going to bring interventions to Corner Brook or Goose Bay, Labrador. Well, we're experts in applying these things in an urban setting. Our starting point with these rural communities is what they're seeing, what they're needing, and how these things need to be further adapted to be effective in those communities. part of that, certainly in the Aboriginal communities, the line you're referring to, we knew, but we asked all the questions, is land-based programs was hugely important to Indigenous communities. I think that's been established. There's been lots of great programs and models and research done on that. But the interesting thing was, other rural youth that we talked to said the same thing. That, being able to get out on the land, go fishing, or hunting, or whatever it is they do, was a huge part for any rural young people, a person, in addition to Aboriginal youth. So that was the specific reference there. But that process of engagement, talking to hundreds of young people, and then leaders in communities around, again, what the needs are. I mean, it certainly has to start there. I think the other piece for us then, again, is in a very holistic way, thinking about the employment needs of young people in those communities, to go along with their housing needs, to go along with their mental health needs. I think I've been doing this long enough now, and I keep repeating to people, this is not about correcting one system. This is about looking from a all system approach to what are all the pieces involved in the lives of young people, whether urban or rural, and affecting change in those systems. And hopefully that answers your question, just in terms of that piece of it, Terry.
Yeah, that's great. We have some folks saying that they can't see your links you shared, Sheldon. So I'm not sure if it's. I think you shared it with just panelists. Can you switch your?
Maybe I did. I apologize. Look at that.
Either way, we'll make sure you get them, folks. Though. Mike, Holly.
I'll copy and paste and send them out to everyone else.
Okay.
I didn't catch that.
Technical difficulties always on these webinars.
Especially when you're talking to me.
Yeah.
So,
Holly, go.
Yeah. So some of the challenges are also some of the reasons that individuals have chosen to come here. And that is seeking employment, to access emergency shelters, to find housing, and to access services and supports, and medical. So I'm going to expand on that a little bit further. To find housing is interesting. We actually have a housing monopoly here. There's a real estate investment trust that owns the majority of the rental market. So that's an issue on its own. And we're finding with COVID, especially, our income assistance here does fund rent, but only to a certain amount. And right now with COVID and with evictions and everything else, there's actually nothing available within that rental amount. So there are people, for example, in our Youth Housing First program that we can't house because they're on income assistance and there's nothing within their rental allotment that we can find for them. So that's an issue. Medical is another issue, and it's through talking to different service providers where individuals come here for medical, and then they may come from a dry community, they may come from a different community and have friends or family here and make the decision to not get back on the plane when they're scheduled to and stay, which then results in a lot of people living homelessness, which then when they're ready to leave, they can't necessarily leave because they don't have the funds to buy a plane ticket to return. So that contributes as well to homelessness. The access to the emergency shelters. Well, right now during COVID, due to the CPHO restrictions, there's another temporary shelter that has been temporarily opened. All the shelters are at full capacity. So that's another issue. So it's definitely challenging. I don't think that there's been any advantages. And then I have a couple other reasons why people have moved here that I didn't share earlier. And some of them were to seek employment because their family moved here, or to visit family and friends.
Mm-hmm. Yeah, that's a big one, actually. We track our migration now from within our agency. We can actually watch where kids go and what community they go to. And what we found now is that now that we're offering a Housing First program in our community, the migration to the city is pretty much non-existent unless it's sort of an emergency need and somebody else probably sends them there. But most of the young people who move out of our community now are actually going to stay with a family member somewhere, and it has nothing to do with city. It could be a small town next door, it could be anywhere, but they're staying with natural supports as much as they can, for sure. Yeah. Mike, what about you?
Yeah, and I think I can concur with both what Sheldon and Holly have said. I mean, that is what we're seeing, especially the land. I think the key piece is kind of like the community belonging, which I'm a pretty big data guy, and I've really tried to steer our agency away from the anecdotal story as a way of sort of justifying our services. But I mean, that is a key piece to this. It's the ability to belong in your community is critical to ending youth homelessness. So the big migration factor, less for us because we're working specifically with youth, is less about employment. There is some need to get away from communities. There might be, you know, there's certain times when people do need to make a move in order to make a change, but I find that is a much smaller amount of the population than what was currently coming to us. Largely, it was just driven by the fact that they had sort of burnt all of their ability to resource themselves locally, and then they were forced onto the highways to the next largest urban center. And so if you look at the Niagara region, like I said, the highway goes from here up through Toronto, and it passes through Hamilton, and pretty much at every major urban center that's bigger than St. Catharines, there's just that bigger shelter. So, you know, Hamilton would have a 50-bed shelter, and then ultimately Toronto has the 100-bed shelter. So, I mean, it's pretty obvious where the migration is. The vulnerabilities, I think, were probably the thing that kept me awake at night. When we started doing that original look back into who the youth were that were utilizing our programs, it was clear as day that the youth who were from St. Catharines were much better off initially when they came to us than the youth who were coming from outside of St. Catharines. And I mean, it's not rocket science. It makes sense, but it wasn't something we understood. Again, we thought the majority of the kids we were serving were from St. Catharines. So human trafficking, massive. That's a massive vulnerability when people are moving. You know, obviously the drugs and criminal justice, like all that just becomes, and what we're finding is that whatever the initial trauma was, because the majority of youth who were accessing our services would have reported a conflict at home. That could be anything from just, you know, a disagreement that couldn't be resolved between parents and you know, to all the way up to, you know, full on abuse and all that stuff on the far end of that scale. That's kind of, so it's a very large, broad concept, but that's kind of what caused our youth to leave home in the first place. So, I mean, that's traumatic enough. But then the traumas that they had to endure simply because they had to travel, unspeakable, absolutely unspeakable. And we really rooted a lot of our kids in the homeless service system because we weren't able to provide them the supports they needed when they needed them, and we forced them to come to where the services are. So, I mean, it was just absolutely horrific what we were seeing. And so that really was one of the biggest pushes for why we ended up running our program that works in rural communities to identify students. So we work with high schools to identify students who are at risk. And our data showed at the time that the majority of our kids, almost pretty much 99% of them, had been in high school immediately prior to becoming homeless. So that's why that intervention has been so powerful. And really it's, we couldn't open initially. We were looking at potentially opening another, you know, raft in a smaller community, but it just wasn't cost effective, and we wouldn't be able to have even if we could raise the money to do it, it would take too long to do. And so that's where we started to think about, well, who are our partners? And it's odd that we never considered the school board our partner in ending homelessness, but it's just so obvious now that, but it's, again, that's why I say, I mean, it's pretty ridiculous actually how we ran services at one point.
Right.
And I'm pretty embarrassed about it. But, you know, once you sort of came to it, it made sense. And the nice thing is that pretty much every school or every rural community has a school. So they might not have services, but they have schools. And because we know we work with youth, because we know they're in schools, that's, that became a huge infrastructure boon for us, that we had a place to base our work out of. And then, I don't know, did you want to talk about like some of the successes to it, or are we just talking about vulnerabilities at this point? Or should I?
Well, yeah, I think if there's any advantages to being sent from a small community to the city, would there be any advantages to migration?
There are some, like I said, there are some absolute cases where I think leaving your community is probably in your best, especially if there's like, real fundamental human rights disagreements between you and your, your guardian or parent. Maybe LGBT could be, that might be one where you might want to move. Obviously abuse, but I think the advantages are much smaller than the vulnerabilities in the general scheme of things. Right.
Yeah. You touched on something interesting, Mike, actually, when you said that the young people you were seeing from the rural areas who arrived in the city were actually in worse sort of shape in terms of, where they were at in their process. And I'm wondering, I would say that's similar to what we see in Leonard County, in the sense that the young people that are still today sent to a shelter are often the ones who burnt every bridge within the rural community. And so somebody says, that's it, you're going to the shelter because we have nothing for you here. So I wondered about that, if, those are the people who've struggled the longest probably with homelessness, and in fact are probably the most vulnerable that we're sending out, and probably adding to the problem. Yeah.
Really the most vulnerable. And I think the key thing to remember is there's a whole, we think this is kind of like an apathetic system, that things just kind of happen and they're sort of neutral, right? At best, they're kind of neutral. We talk about migration, I think we kind of just envision this process that's neither particularly good or particularly bad. It's just kind of the thing that happens. But one of the things we came to a realization is how many people are waiting on that line, are waiting at that sort of terminus to basically, it's almost like a predator prey. Like, they have, like, so drug dealers or pimps know that these kids are coming in. They know they're vulnerable, and they know where they're going to be largely grouped, at bus terminals and these places of transit, and would be waiting for these kids. So there's a really it's just like sort of a, I don't know the word. It's evil is what it is, but it's not just this sort of benign thing that we're talking about when we say this word migration, which kind of just doesn't give you a feel for anything. There was really a group of people that were taking advantage of that system, and were set up to take advantage of it. So it wasn't, it was very intelligent in how they went about doing what they did. So that contributed to the whole mess. And that's why I think sort of tackling immigration is so important, because it isn't just this, they don't know where they're going when they get here, and maybe they fumble around for a little while. There's active people out there who are looking to, just use these kids up for everything they're worth, and then ditch them back into the system.
On the topic of forced migration there, Mike, and it's not just like, we don't also see like human trafficking and stuff like that. It's not just criminal involvement that happens. So in Kingston, we're surrounded by institutions, criminal incarceration. And so we see forced migration by our justice system. So we have adults who are leaving an institute incarceration and then are being told by their parole officer they must stay in Kingston, even if their hometown is, it's Toronto or wherever. And so they're forced to stay here in this community where they know no one and have no natural supports. We also have, and Terry, I know you know of this because you're from the same area as me. We have police officers who pick up people who are homeless in rural areas and just drive them to the city and drop them off at the doorstep of shelters, because they feel that's their only option. And maybe they're doing it because they think it's going to be beneficial to the clients to have a place to stay for the night, but we're uprooting them in such a way that's potentially traumatic.
Yeah, Well, you touched on two good points. Yeah, I do actually, I don't believe that people send young people or adults to the city because they're trying to harm them in any way. I do think they think in some respects that is the only option. We can't leave them on the streets here, so we got to send them to a shelter. And I think part of that is a lack of exposure to the shelter system and how hard it is to actually find housing in the city as well, right? So, you know, I know of one young person who was sent to a shelter in Ottawa 2 years ago. He's never left. He's still in the same shelter. So 2 years later. So, I think that's important to talk about that. And I also think, you know, Covenant House, I believe, Sheldon, you might know about this, maybe Mike too. Covenant House did a great research project on the vulnerabilities in shelters and risks for human trafficking and recruitment out of shelters. And I think, you know, any of us who, I worked in group homes a long time ago, I think any communal living environment, you're going to increase the risk when it comes to exposure to drugs and trafficking and survival sex and a lot of other risk factors for sure when it comes to communal sort of settings. But again, I don't think that people, I do want to emphasize, I don't think service providers are trying to cause harm to people by
No, I don't think so either. I think
there's
there's a big misunderstanding of what shelter life actually looks like. So I used to work at the adult shelter here, and a lot of time service providers would call in and they would think that it's a warm bed, it's staffed, they have support 24/7. They don't, and just because of lack of exposure, like they don't know what happens in shelter and what that looks like. So their heart's in the right place and trying to connect them to services, but inadvertently exposing them to potentially harmful.
I don't want to speak on behalf of my brilliant co-chair, but he is actually texting me and he's on this webinar, but he was just talking about this very factor that, you know, even the risks involved in busing or hitchhiking or trying to, you know, get to the city, there's increased risks as well, right? And so, and very vulnerable populations too, like missing and murdered Indigenous women could be a factor for that too, right? Trying to move between communities and access services. So, so Sheldon, did you want to add something to that?
Yes, I think I agree with everything everyone's added. I'm not going to repeat that. I think for us is also recognizing, well, certainly, you know, when someone puts someone on the bus in, you know, central Newfoundland and sends them to our shelter with, you know, a bag of all their possessions in one hand and our address in the other, you're right, they're not doing it to cause harm. And they're not necessarily doing it because they don't understand the perils and challenges. They're doing it because they literally look around and like, this is the closest option. There is nothing. There literally is nothing. So it could be a social worker in central Newfoundland saying, well, the closest shelter is that one.
Yeah.
Nothing, and the young person is sitting in their office and has nowhere to go. So sometimes it's not about a lack of understanding, is that there really is no other option.
Yeah.
Straight up.
Yeah.
And that speaks to how the system needs to shift to create, so the closest shelter, you know, 500 kilometers away, it should not be the solution. And everyone knows it, but yet that's where we are. I think the other piece for me is speaking in terms of, like, I don't think any of us are going to slow down the attraction of the big city from a youth perspective. Let's be real here. And there are such thing as healthy transitions to an urban setting. There are such thing as, you know, based on, you know, some mental health needs, if it's severe enough, yeah, they do need to be maybe where some more significant resources are. So there are examples where, if done right, it can be a very healthy thing. What doesn't work is the bag in one hand and an address in the other, and good luck to you. That doesn't work so well. So one of the initiatives that we are going to be implementing through our support from the federal government is, you know, I guess, a soft landing program. People who its job it is to be the conduit for the person in central Newfoundland. And fair enough, until we have a solution in central Newfoundland, young people are going to continue coming to our city for supports and services. But even in that scenario, we can do a much better job of receiving, supporting. You know, if a young person gets what they need, maybe transitioning them back is the right solution, or minimally helping them transition to the city in a safer, healthier way. Because could be this is where they're likely to get their needs met. Could be this is literally free choice is a thing, even for young people, where they want to be for all kinds of reasons. So the solution is absolutely giving more options in closer to home communities, but where it's necessary or young people simply choose to end up in an urban setting, do a much better job of that process and supports and getting them set up and helping them connect to all the things that we know they need, you know, whether they're in a home community or here in St. John's. So that's a piece I would certainly add to that conversation, because I agree with everything everyone's added at this point.
Yeah. Well, and I think that's an important point, Sheldon, too, because I think you know, part of it comes down to choice. We all talk about choice in the housing sector, right? The idea is to give people as many choices as possible. That homelessness is often as a result of a lack of choices. And so I think certainly, and natural transitions, I think, not to focus completely on youth, but natural transitions for youth is that they're going to move on their own typically anyways, for college, for school, for work, for family. So, but you kind of, again, you want them to do that in a way that's healthy and connected. And so, yeah, so, and I would also say in terms of rural areas, we send young people out of, or adults as well, out of our communities all the time to access services, psychiatric, mental health, medical, you know, those sorts of things, and people come back. And I think that's the key is, do they have the choice to come back? And now that we're, you know, talking a lot about the right to housing in Canada and beyond, it's one of the things that I'm talking about in terms of an advocate for rural communities is that we should have the right to housing in a community of our choice as well. And so even if you choose to leave for a period of time, you may choose to come back. And do you actually have that as an option? So, so the last piece, and you've already touched a lot on it already in your comments so far, but could we give sort of some concrete examples of what you're doing specifically that works that other communities could actually use and run within their communities?
I'll start, Terry, just to, your segue is good. The right to come back. So what I do whenever I have a client who's come from a rural community and is now in Kingston, maybe they're in shelter or staying with family. So whenever possible, I always try to facilitate them returning to their home community, because we know like they have a connection there. They probably have friends or family, or maybe that's just home, right? So whenever possible, I want to make sure that they get access to the services here and then get set up to go back. So maybe that's assisting them looking online for places. Maybe that's calling the local social assistance office and getting their file transferred and setting up a place to stay for when they get there, whether it's natural supports or it's permanent housing. Mm-hmm. So we don't have a specific policy on that, on like how we support people to return to rural communities. Mm-hmm. But in general, that's what home-based staff have always done, is just try and reconnect back to home communities whenever possible.
And Cassandra, do you find that when a service provider calls you and says, hey, I've put a person on a bus to you guys to send you to the shelter because we don't have supports for them here, do they follow up? Is there follow-up, do you find, or?
It varies. I'd say it's really case by case. Sometimes there is, and it depends on what agency they're calling from. So if it's like social assistance, it's less likely that there's going to be follow-up because their case file is closed and transferred while they're in Kingston. If it's children and family services or like mental health services, they're more likely to have some to reconnect and follow up as to what the status of the client is.
Okay, great. As you were talking there, it made me think about transferring of services is a serious issue too, right? So in Lanark County, if you're with the Lanark County Social Assistance Department and Lanark County Housing Department, then you have to transfer your services if you want to move to another community. So you have to call and get your OW transferred, your ODSD transferred, your any of those other pieces. And so, and that's complicated for people. If you have to wait 24, 48 hours to get a response from somebody, but you've been sent and dropped off into a city and you haven't transferred your services yet, right? There's that whole like period of time where you have to do all that work to just even get supports when you get there. So
yes, it's so hard, especially getting trying to get housing secured when they haven't transferred their file yet, and then we can't access funding to get them the last month's rent. Hugely complicated.
Yeah, agreed. We lost Sheldon there. He said his whole system went down, but so hopefully he'll reappear. But Holly, Mike, you guys want to go next? Things that actually work, things that communities could do right now.
Sure, I'll take a swing at it. So I sort of mentioned, we started a program called Youth Reconnect. As I sort of talked about earlier, it helps identify, it works with schools to identify students before they become homeless or just on the verge of homelessness. And then we have a worker who actually is, so it's geographically based. So we have a worker who has a set number of schools in a certain geography. and then that worker coordinates with the schools and then with the students to help sort of determine what the principal factors are behind, the potential homelessness, and then secure housing. So probably one of the biggest successes we've had, though, is really, and I mean, it's touched on a number of times, is this idea of returning to family. And by family, I'm talking a bit broader. I'm not necessarily just talking about, nuclear family. I'm talking about all the siblings and, cousins and aunts and grandparents that typically do still live in the community. And so one of the things, especially when I started, family was kind of seen as like not such a good thing. It wasn't such a good option. And we were sort of under the assumption, again, that family conflict, which I've already mentioned, was the #1 reason for our youth seeking services. So it didn't, I guess intuitively, it didn't make sense that we then approach the family as a solution to it also, right? So although our thinking has now evolved, like I said, there's more to it than just, there's color within that spectrum of family conflict, right? And so, having someone that can do a bit of mediation with the family. But one of the things we did do, especially in this time of housing affordability, if you look at it, I mean, if you think about it, for the group of 16 to 30-year-olds in North America, not just Canada, but all of North America, the majority of them actually live at home. And so family is the single largest affordable housing provider for youth 16 to 30. So by not engaging family as a first option, you've taken the largest housing provider, affordable housing provider, off your table before you even, and so obviously that narrows down what solutions you have, right? So that's why families, that's the main reason from a housing perspective that why family is so important, because they are the single largest provider of affordable housing in Canada, and it's already built, and you can access it. So it's the best place to start, and then you get into the whole belonging piece that I was sort of talking about around. We really don't do well as people when we don't have a history, and that history goes through family. So there's just something, I don't know if there's ever been a study to measure it. I don't know if this is something, but time and time again, when we talk to the youth that we've managed to house and sort of work through, that was something they kept telling us, is now I know who I am. I know who my people are. And that seemed to center them. And, that's what it took in order to, it's almost like all challenges are somehow able to be confronted when you know who and where you're from, which is unchallengeable and overwhelming when you have no place in the world. So, that whole bit of belonging and family, I think, is the critical piece to this. When we talk about migration, that's really a symptom of what's happened, the breakdown on that side. So, guys, that's been our working with families, identifying where, like, schools, and then normative rec programs. So we really don't want to stigmatize youth. We don't want to necessarily have them come to a homeless serving agency. We really want them to engage in the services that are the normative services for youth in their community, which is the least stigmatizing approach, right? So, and especially in the rural communities, do an excellent job of providing community resources in that rec style, right? Like those youth events, and there's really a richness across rural communities. So really taking advantage of that, which is where we want our kids to be. So I think those were sort of the concrete and a bit more, how to think about it. But that's really been the secret to our success.
Great. Yeah. And interestingly, Micah, I mean, you, I, Sheldon, Cassandra, all work with youth specifically, but I get calls from other people from the community, as you guys may as well, right? So, and adults, I get calls from like 16, 17-year-old adults who are still providing care to their 40 and 50-year-old children because they suffer from disabilities or mental health issues, right? Same thing. Parents are still there trying to support their children. And so they're a sort of undercapitalized resource for sure. We should be supporting families more and preventing people from coming into the housing system to begin with if we can. So Holly, do you have anything to add?
I was just going to say, for our community, what we're hoping to find is once we get more into coordinated access and build a by names list, that through that we will have a housing history, and have a better understanding of migration inflows and outflows, and what is bringing people into the community, and if they choose to stay here or if they want to return to their home community. Also, the government of the Northwest Territories does have a homelessness assistance fund, which has actually quite recently come in handy. There was a young woman here that wanted to return to her home community, so they were able to facilitate that. So that's pretty great as well.
Great. Cassandra, what about you?
Sorry, pardon?
Do you have any in terms of what you've seen really works well? Like, are the things that really
Yes, so
well?
that's what I was talking about in terms of reconnecting with natural support. So taking the time to find out who they still have in their home communities that are their supports. So whether that's family or friends or mental health or social assistance, whatever supports are already there. That's always been the best route in order to get people home, to get people secure.
Right. If anyone who's watching has any questions, by all means type them in. We'll get to them, but otherwise I'll just go around and ask everyone if they have any final thoughts around the issue of migration. You have some great models. I've had the great fortune of, Mike, I haven't visited your program yet, and I haven't been to Yellowknife, but I have been to Homebase and I have been to Sheldon's. So it's part of the reason why I certainly extended the invitation for you folks to come, because I knew you were all doing this work and we've had conversations about it previously. So thank you for that, because I think, again, it's this topic that we all know it's like the pink elephant of homelessness. What do we do about migration? Is it a good thing? Is it a bad thing? What are the risks? How do we work within it, recognizing it's going to happen? So how do we do that? So you guys are all doing some great work, and I appreciate you taking the time to do this. So one last opportunity. Any further comments?
Just, I think there's a real opportunity when you work in the smaller communities. I mean, migration might be the symptom that causes you to sort of address it, but I think once people get to the larger cities, you're really almost dealing with needs at that point, like physical needs, like where when we're working in the rural communities, I think we're addressing systemic inequalities, and so I think that's really where the big wins are. And that's the real chance of success that we can have, that will change a person's life over the long run, as opposed to supplying a bed or supplying a hot meal or supplying a jacket or these physical needs. It's really systemic inequalities that we need to address, like the ability to go to school, the ability to be educated, the ability to be housed. That's really the opportunity that presents itself if addressed in those the smaller communities where people are migrating from. And so it just makes perfect sense to me that if you really want to make change, it's not going to happen in the cities for the people who aren't from the cities. It's really going to have to happen in the communities where they're from. And if we can do it right, you really can change lives at that point. So.
Well, Mike, you and Sheldon are both great examples of how an agency can actually really intentionally address this issue and look at it and say, what do we need to do to change this? What's best for the people that we're supporting, right? Put systems in place to do that. So that's really important for sure. Anybody else?
I think from my perspective, we talk a lot of times in the language of acuity, right? So we have a high acuity site in downtown St. John's that does a lot of what Mike is talking about. It's already escalated to the point, whether it's mental health addiction or just the whole thing is broken down to the point where it's really around food, a pair of shoes, a toothbrush, and then building back from there. So we go through this process in that environment to say it's a youth engagement program, right? Because I can feed a young person a hot meal every day for the next 20 years by itself, great basic needs, but it's not necessarily going to lead to the change that the young person wants. So the food is a means to an end. The engagement is where the real change can happen, and young people can actually begin to feel empowered around their own lives and making decisions and that sort of thing. So it's really around a lens. If that works that way for young people, when they walk into our high acuity site in St. John's, and how do we get to preventing that escalation of crisis and acuity? Well, then if you look at it from a migration perspective, is that long before that young person needs to migrate and escalation of crisis that goes with it, we can get to that earlier and sooner from a lower medium level acuity, so it doesn't actually become a high acuity situation. Actually, the Foundry model, Steve Matthias and others who are working with us around making this come to fruition here in Newfoundland, their sites are actually defined as low to moderate acuity sites for that very reason. Are there high acuity people that will be challenged and support and have systems? Absolutely. But how to shift the system so that we focus more on whether it's rural or urban, but in this case, a rural conversation. How do we implement systemic change so that that escalation of fire crisis does not have to happen? You think really when you look at it, the whole thing is a prevention lens. It's applied in a different context, but it's still all about prevention.
Mm-hmm. Yeah. You and Mike have done a great job about highlighting all the work we're trying to do with the National Alliance to advocate for increased resources for rural communities. See it as a prevention model. Proper investments will help prevent homelessness for sure. Holly, Cassandra, any last thoughts? We're good? Thank you so much. It's been so nice to see some of your faces. It's been a while. Look forward to being able to get together sometime soon. But you're doing fabulous work, and I hope everyone stays safe and healthy. And we'll be posting this recording on our website, the National Alliance to End Rural and Homelessness website. So if you're looking for a recording, you can head there. So, thanks, everyone. Stay safe.
Thank you. Take care.
Bye.
Bye.
Are you done?